Hello students, myself Rajesh. So आज हमरो टॉपिक थिला टैबलेट डोजेज फॉर्म which is helpful for bachelor and diploma pharmacy students. So coming to the topic, tablets are solid unit dosage form. Mostly here we can take a tablet as a single dose at a time, and also it is solid in nature. Its physical form is solid form, right? So coming to the definition, according to the pharmacopoeia, the pharmaceutical tablets are solid, flat, or biconvex dishes, and also these are unidosage forms, and also it prepared by compressing a drug or a mixture of drug. It means in a tablet dosage form, we can see one drug or multiple drug in one composition. At the same time, with or without diluents. Diluents. What is the use of diluents? Diluents are the fillers or so-called this used to increase the bulkiness of a dosage form, which will give the proper weight and size to a tablet. For example, what are the diluents we use in a pharmaceutical tablets? That are dextrose, right, and also starch and kaolin. So these are the some examples of diluents which is used in a tablet dosage form as a fillers, right, to give it a proper weight and shape, right. Apart from, we can use in a single dosage form, we can use in case of solid dosage form, mostly use the API, which is main medicament, plus excipient, right. What is the use of excipients? The excipients used for different purposes: to enhance its performance, also to ease the manufacturing process, right. So what are the excipients? This may include the diluents, binders, glidants, lubricants, disintegrants, sweeteners, and flavors. So diluents, already we know that these are the fillers. So binders, in case of tablet granulation, so in case of tablet granulation process, we can use the binders. So why we need the binders? It will increase the adhesive properties of the granules, which may resulting in the strength in tablet formulation, right. Next, glidants. This will increase the flow property. To increase the flow property, we need to add the glidants. Lubricants, it will give the smooth movement in case of dice and punches. Disintegrants, mostly used for make the tablet or available the tablet in presence of water to disintegrate itself. Sweetness, to mask the bitterness. Flavors, to improve the compliance or taste of a tablet. So it will be, if we use some flavors in case of child, they will be attracted to take the medication. If it is bitter in taste, they will show some vomiting sensation in child case, or they will not accept the medication. So flavors are important for child case, means in child medication cases, right. Apart from that, what are the advantage of tablets? So in case of advantage, mostly it is a single unit dosage form and convenient to use, right. It is used as a single unit dosage form, also convenient to use. Why it is convenient to use means, here no any guidance is required, but in case of injections we need a nurse for to take the injections. So in case of some critical inhalation drugs, we need some proper guidance. But here, anyone can use a tablet because it is a single unit dosage form. We take from the strip and consume it. So next, drug having unpleasant taste means, which drug having the unpleasant taste means bitter taste or some unpleasant like taste. It can be masked by using different polymers or different excipients or different coating, which will increase the patient compliance. Means patient will be better, feel better to take tablets comparative to other form of medications, right. Tablets may be designed to release at the drug site, means it is a controlled site or desired site. We need to release a drug in case of stomach. So for that we choose that type of excipient which will helpful to control that stomach. Or we need to release the drug in case of intestine. So in that we use the enteric-coated tablet which is release the drug in the intestinal pH. So depending upon pH we can control the tablet to release at a desired site at control rate. Means for a long time we can release a drug slowly which will affect the long time or prolonged pharmacological effect. Right. Next, tablets may be easily manufactured to show product identification using the colored coating, embossed marking, or printings. See here the tablets where we can see the marking, means we can break here to take it half. In case of child case, we can break this tablet by this marking, and also different colors are there, different printings are there to identify the which tablet it is and for which purpose we can use or from which company it manufactured. So we can identify the tablet by different type of color coatings and printings, right? Coming to disadvantages, what are the disadvantages of tablets? Mostly from for unconscious patient we can't use tablets, right? In case of some patient have coma situation, so in that case we can't use tablets. Also there is a product loss is more. Why? Because during manufacturing process we can go through a number of process like weighing, milling for proper mixing, drying to lose the moisture content. Why drying is necessary? Because moisture will affect the tablet stability. By what means? So by increasing the microbial growth. If moisture is present, means there is a chance of growth of microbial, or there may be a chance of degradable of its strength, right? Next, mixing. Why mixing is necessary? To make the uniformity of content, right? Means in every each tablet proper amount of API plus proper amount of excipient need to be available. If there is increase in API, it may be give the toxicological effect. Of there is a decrease in API, it may be so zero effect to the specific disease. So we need to maintain the content uniformity of content in order to get proper pharmacological action, right? So apart from that, chances of patient to patient variation are more. Why the patient to patient variation? Because every individual patient have their specific physiological factors, means that body organs will be sometimes maybe properly workable, or some other diseases which affect the tablet release or tablet absorption to the blood circulation or to the systemic circulation. So here mostly the release and absorption of the drug depends upon the physiological factors of a human being, or so-called gastric resident or emptying time. If the gastric resident or emptying time is delay in some patient, it will show the delayed pharmacological action, therapeutic action. So like that, every individual patient and their disease history will also affect the tablet release absorption to the patient, right? Which will be ultimately affect the therapeutic therapeutic effect to the individual patients depending upon their individual physiological conditions, right? Apart from that, we need to discuss about the ideal characteristics of tablet. So when we can say a tablet is ideal, so first of all it must be strong enough to withstand the mechanical shocks during packaging, during shipping and dispensing, and finally at the time of use by the patient. It mostly in industry we can manufacture the tablet, but it can need to travel that long distance to reach the specific patient. So in this meanwhile it can means withstand the mechanical shocks, right? If this tablet is not strong enough, it will be breakdown, right? If the packaging is not proper, it may be degrade the tablet quality or quantity. Also react with environmental factors which will affect the stability of a tablet. So apart from that, must be uniform in weight and its drug content to get the 100% bioavailability after consumption of a tablet, right? If the uniform in drug content will be lost, it may be affect the pharmacological action after consuming the tablet. It may be adverse effect to the patient. Why? Because it will be contaminated with some other factors during its transportation or during its low quantity of API or its high quantity in the drug. It should be elegant and free from defects like cracks and discoloration. So in here we need to consider that appearance of a tablet should be proper. So there is a no cracks, and also discoloration means the color coating will be properly done, which will increase the appearance of tablets. Next, the drug release from the tablet should be predictable. After consumption, we can predict the tablets, the pharmacological action will be so within this time only. So we can able to predict the drug release from the tablets. Why how we can predict? Because we know what type of disintegrants are used, we know in which time it will be disintegrate, after in which media it will be dissolved. So after specific time we can assume that okay, after consuming this tablet within 3 to 4 hours we can get the proper pharmacological action, right? Next, it must be chemically and physically stable to maintain its chemical and physical attributes, means quality, chemical and physical quality it need to be fulfilled during manufacturing, storage and use. In these three stages it will fulfill its chemical and physical attributes, right? Next, its classification. So we know, we discuss the definition and also the advantage and disadvantage, also the ideal characteristic of a tablet. Coming to its classification of tablets, we can classify according to the route of administration. Means we know that tablets are the single, right, unit dosage form, also the solid in the solid form. Next, coming to its classification, according to its routes of administration, we can classify it as first one, tablets ingested orally. There are tablets which we need to take in oral route. We can classify as first one, compressed tablet, multiple compressed tablet. In here there is a subclass compressed coated tablet and also layer tablet, and delayed release tablet, sugar coated tablet, film coated tablet, and chewable tablet. These are the tablets which we can use by the route of oral, right? Apart from other oral route, some tablets are there which release their content in oral cavity. Oral in the sense it will be disintegrate in our stomach or intestine. But some tablets are there which will disintegrate in oral cavity only. So it will not goes to the stomach where it is disintegrate, but it disintegrated in the oral cavity. For example, the buccal tablets which will show its effect in our buccal cavity. Here you can see that buccal cavity. Next, the sublingual tablet below the tongue, right? There are troches or lozenges, mostly the Vicks. Example is Vicks, which will affect in our throat section. Next, dental cones, which will replace here for mostly the dental cones are used for the decrease the microbial effect or also the pain after tooth extraction, right? Next, tablets used to prepare solution. The most tablets, some tablets are there, it will first dissolve into some solution, after we need to consume it. Mostly the effervescent tablet, eno, example is eno. Next, dispensing tablet, hypodermic tablet, which is take as a injectables, and tablet triturates. Some potent drugs are there which will we need to manufacture as tablet triturates. So we see the classifications. So we need to know about one by one. So here we can see the effervescent tablets. Here see tablet in the dissolution medium which will show the effervescent action. Here also. Here the hypodermic tablets which will dissolve in a sterile solution, and taken as a injection form of dosage form. So here for the tablet triturates, those are potent drugs for we can use as a sublingual tablet mostly in case of heart, right? Coronary heart disease. We can take as a potent drug as a sublingually, which will affect systemic effect within short time of period, bypass the liver, bypass the fast class metabolism. The tablet ingested other routes, these are implantation tablets and also vaginal tablets. Implantation means mostly the steroids, right? These are the implants. We can make a minor cut in our skin in case subcutaneously. The implants are taken either subcutaneously. We can do a minor cut and ingested this implant. Also the vaginal tablets, most of it they are suppositories, comes under the vaginal tablets, which will release the drug by the action of temperature in the vaginal place. It will release it, and for most of it to for means bacterial infection. So apart from this, one by one we need to discuss. So what is that different type of class according to the classification we need to know one by one. First one, compressor tablet. So mostly it is, these are the compression of powder. Compression tablet made by compression of powder. It contain the API as well as excipients. These two things are only present in this compressor tablet. No other any polymers or some coatings or some layers are available. These are only API and excipient directly compressed to make the compressed tablets. So these are designed to provide the rapid disintegration in gastric fluid. So due to we no need to use any polymers, so it gives the rapid disintegration after it come to the gastric fluid, and due to the rapid disintegration it will allow the rapid release of drug. Ultimately the systemic absorption of the dosage form is speed, okay, rapid, right? So next, the sugar coated tablet. So why we use sugar coated tablet? So because these are also the compressed tablet, but we need to here use a sugar solution is a coating over the tablet. We use the sugar coating, which will make the simple tablet to sugar coated tablet. So the importance of sugar coated tablets to improve the patient compliance by increasing the aesthetic appeal and masking the unpleasant taste and odor. If some tablets have the unpleasant taste and odor, which will cause the some vomiting, nausea sensation in human being. So by making it sugar coating, we can improve the patient compliance, right? So apart from that, film coated tablet. Why you use film coated tablet? So mostly the coating is designed to break and expose the core of the tablet where at desired location of pH. Mostly the film coated tablets made up of some polymers. Here we target the pH of our internal system. Means we, in stomach we have different pH. In intestine we have different pH. So here pH condition is different. Here also the pH condition is different. So depending upon pH, we choose the polymer which is suitable for the pH, specific pH. There only the tablets will be disintegrated, designed to break and it exposed to the core of the tablets, mostly in the GI tract, right? It is also the compressor tablet coated with thin layer of polymer mixture or mixture of polymer, simple polymer or mixture of polymer we use to make it film coated, right? So next, our effervescent tablets. So what is effervescent tablet? Which are mostly contain the organic acids. For example, your tartaric acid, citric acid, and sodium bicarbonate, along with the drug with excipient. Main our drug is there, excipient is there, plus we can use the organic acids. For example, tartaric acid, citric acid, and sodium bicarbonate. So how it will be work? Most of its mechanism of action is simple neutralization reaction, which will release water and CO2. Mostly our water is a base and we are use some acids. When it is neutralized, it will evolve the CO2 carbon dioxide gas and by means of effervescence it will show the effervescence. So here the release of carbon dioxide act as a disintegrator. So whenever the reaction is done, after reaction the carbon dioxide is evolved, so the carbon dioxide used as a disintegrator which will break down the tablets, and after breakdown it will dissolve in the respective liquid media. After that we can consume it. So to produce either a drug suspension or an aqueous solution. After disintegration, the complete drug substance is a example of a suspension or a aqueous solution, right? Next one is enteric coated tablet. These are the compressed tablet, but we can here use as a polymers. For example, cellulose acetate phthalate and cellulose acetate butyrate. We have a delayed release property. So why we do the enteric coated? So here we can achieve the delayed release of tablet. Means we need to get the pharmacological action for a prolonged time of period. So by slowly it will be disintegrates and absorbed to the systemic circulation. So we can achieve the delayed release of tablet, right? Mostly the drugs which irritating the mucosa, gastric mucosa. In that case, we need to do the enteric coating of tablet, right? Next one, the polymeric substance which will reduce the degradation of tablet at gastric fluid. So mostly it will release or it will degrade in intestine. So the enteric coated tablet, the drug will be released in intestine only, mostly, right? And the drug which is getting inactivated or destroyed by the gastric acid. Some drugs are there which will destroy in the gastric pH or gastric acid, so-called HCl. In that case, we can use the main means protein API to make it enteric coated tablet. Example are erythromycin. So your example is erythromycin, right? Coming to next, the buccal or sublingual tablets. Mostly the tablets dissolved in buccal pouch or beneath the tongue, so-called sublingual tablets. So why? For absorption through the oral mucosa. Mostly in case of buccal tablet, the tablet is absorbed by, or the main drug is absorbed by the oral mucosa to produce a systemic effect. It will show the systemic effect, but the drug is absorbed through the oral mucosa to achieve the rapid absorption of it into the systemic circulation. In case of heart attack, when we got the coronary artery need to be relaxed, in that time we can use the sublingual tablet which will relax your heart muscle and you will be safe from the heart attack, right? To enable oral absorption of the drug that are destroyed by the gastric juice, means some drugs are destroyed by the gastric juice. In that case, we need to form it as a sublingual tablets or poorly absorbed from the gastrointestinal tracts. So which the drugs which is poorly absorbed by the GI tract, in that case, we need to make it as a buccal or sublingual tablet which will be absorbed by the oral mucosa, right? So next, lozenges or trousers. So these are the disc-shaped solid preparation which contain the medicinal agent and generally a flavoring substance in a hard candy or a sugar base. So these are used as treat the sore throat and control the cough in common cold. Right. Also, it contain the local anesthetic, antiseptic agent, antibacterial agent, astringent, and anti-tissue agent. Right. Hypodermic tablet. These are administered by parenteral route of administration. First, we need to dissolve in sterile water or water for injection. After, we need to take it as a parenteral route of administration. So, made up of soluble ingredients. Mostly hypodermic tablets are made up of soluble ingredients because we need to dissolve it in a sterile water. So, precautions are need to be taken during administration to maintain the sterility because here we take it as a direct to our systemic circulation, right? Apart from that, gelatin coated tablet, mostly those drug having the photosensitivity, means these are getting unstable by effect with the photo, means light. So we need to make it as a gelatin coating. So these are the compressed tablet, but the outer coating is made up of gelatin, right? Mostly the drug substance that can irritate the esophageal mucosa during consumption, which will affect the esophageal mucosa. In that case, we need to make it gelatin coating. Gelatin is one of the inert substance which does not have any pharmacological action or reaction with the main API, right? The next one, implantation tablets. So mostly these are insert into the skin by means of subcutaneously. So inserted by surgically means make a small cut. We can insert the implant in the subcutaneous. Tablets release the drug slowly over a long time of period. Mostly steroids are used as a implants, right? So thank you students. Thank you for watching. I hope you learned something after this session. So if you like the session, please like, share and subscribe for more lessons. Thank you all.